Okay, guys, so this is the first technique in our webinar series. So thank you for joining us. Thank you for watching it too. So the first muscle we're going to look at today is our wonderful subscapularis muscle. So you guys all know where that is. But why I've chosen subscapularis and teres is they have this really close relationship. So what's really important is if you've got someone coming in, especially with like impingement signs, subacromial bursitis, rotator cuff tendinopathies, especially supraspinatus, first place you have to look is subscapularis and that teres. And the reason for that is because when, okay, so if I grab Scotty here and I take him into abduction, okay, so obviously we've got that small space in there for the subacromial space, okay, we've got the head of the humerus, which sort of sits in there like that. As we go up into abduction, the role of the subscap is to depress the head of the humerus, okay, and keep it from basically butting up into that space and obviously into that joint there. And that's why it's really important. So if you've got anyone coming in for impingement signs, instead of working straight into supraspinatus, and yes, infraspinatus is really important, subscapularis is the most important because that's the one that's going to control the head of the humerus and butting up. So one of the little assessment tool I do before I start with anyone is I come over to that sort of subacromial space just off the edge of the acromion there, almost right onto the head of the humerus as well. Just place my finger, it's almost where the supraspinatus attaches. So what I do, and then I raise the shoulder up, okay? So I'm looking and feeling what is the humeral head doing. So if it's pushing back up into my finger, then I know that the subscapularis is probably not doing its job. So that's the first place I need to go. And obviously what happens with subscapularis is if it's not working well, the teres minor and major will kick in as well. And that'll be really hypertonic and there'll be some cracking little trigger points in there. So that's why subscapularis and teres is so important. So how do we treat it? I mean, I've got three different ways you can treat subscapularis. The first one I'm going to show you is side lying. The next one we'll have them obviously face down supine, and then we'll have them prone. So when do you use these different techniques? It's different for everyone. So that's why I'm giving you the variety of these different techniques and different positions. So Scotty, let's get the head up here, mate. So, yep, on your side, mate. So why I go side lying is sometimes it just makes it easier to get access to the subscapularis. I don't necessarily use cream for this one, primarily because I don't really like getting my fingers deep in there and trying to work it. This is more of a sort of a soft tissue mobilization type scenario. So we pick up obviously the edge. There's the teres there, okay. There's the posterior axillary, okay. Obviously the scap's there. So we're going to come in this way, okay. So we're going to sink into this way. We're going to bring the shoulder down or the arm down, and then we basically push the shoulder down and then we sink in with our fingers, okay. That's the process. So there's not like, it's not a soft tissue technique from the point of view of actually getting in there and massaging it. So you've got to try and make sure that your clients are nice and relaxed in here because they will definitely fight against you if they're not comfortable. Scotty's pretty good here, which is great. But the other thing is too, they might be ticklish as well. So don't play around with just doing light touching there because they'll probably end up just starting to get ticklish. Okay, so you've got to try and make your pressure nice and firm. So once you find that sort of posterior axillary area, so we're going to be up in this area here because there's a trigger point here and a trigger point there. So fingers are going to roll in. So just go into the first point of resistance like so. Comfortable there, mate?
Yeah.
That's all right. Like, give us feedback, mate, honestly. Like, so if it starts hurting, like too much. Okay, so we just sink in, bring the arm down. So keep that pressure on there. Then you're going to bring your hand over the top, push that down, and then you're going to sink in at the same time. So basically you find yourself right in there, okay? So that's the upper trigger point. So now what I can do is just move backwards and forwards with the shoulder, sinking in. So I can go this way, and just keeping the pressure, okay? So it's pretty simple.
Get some refer.
Pain. Yep, okay. And then we move down a couple of finger widths. So now we're hitting the second trigger point down here, okay? So same again, sink in, down, push, yeah, and then right in there. So you're sort of pulling the scap back and then sinking in, so you're hitting that edge of that subscapularis in there, okay, like so. So pretty simple, not hard to do. And then obviously from the point of view from treating teres, obviously what you can do, you can treat teres from this position as well, which once again, get a bit of cream. It's up to you how you treat teres. Once again, there's a whole plethora of techniques you can do, but if you're in this area, you've already worked the teres, then the idea is you can just basically get in there and work it from here. So as usual, broad forearm, okay, not elbow, okay, so we're going to pick up the edge. We know where the scap ends, so we know the teres are going to be in this area here, okay, so we just on there, have the arm off the table a little bit like so. Okay, no, we'll need more cream here. A bit dry, mate.
Sorry.
That's all right.
Should have lubed up beforehand.
Yes, you should have actually. All right, so we just sink in there. You tell me if this is uncomfortable or not. Can you handle that pressure?
10 yeah, that's all right.
Yep. So this is my preferred way of working teres. Yeah, I bet it is. So we can sink in, pick up the trigger point, which is one there. If we go down a little bit further, there'll be another one sort of about there.
About there, yeah.
Yep. And so it's not a huge area that you're working. All right, so we're only sort of working in that little area, that little space there. So it's just purposeful, not too much pressure that he's going to guard against me. Yep, that's like so. So that's pretty simple. That is my preferred option. Obviously we can treat them face down, but you're going to have to end up using your thumbs, and you know what I feel about using your thumbs for everything, because it obviously ends up ruining your thumbs. All right, so the next position, technique we're going to do is we'll get you face down this time, Scotty. So this is, you know, once again, like depending on your clients, how do you get to subscapularis? Sometimes this will work better doing it this way. So what we're going to do now is we're going to have the arm down the side here. Once again, I'm going to use a towel. I probably should have had a hand towel, but anyway, doesn't matter. So I'm going to come over here. Sorry, mate. Hopefully you can breathe there. So what we're coming in here, so we're coming up and under, like so. All right, so this, once again, we use this position because you sort of got gravity working for you here. So all we have to do, once again, make sure your fingernails are nice and not sharpened, obviously, clipped. So once again, we're going to use a towel. So I'm going to come down here. So I'm just going to push the head of his shoulder down. Once again, it's a sinking in component. So I'm going to come down and up. Okay, and I'm almost on the area that I need to be. I'm going to grab his arm in between my legs here. So I'm going to come all the way down, push down, and then back up again. So I'm in that spot there. How's that there, Scotty? Yep. And then what I can do here is I can just mobilise using my legs, and then I can come down to the second trigger point and do the same. All right, pretty simple. Okay, so once again, it's just coming up and under. So if you didn't find that side lying was that type of technique that was going to suit your clients, then you can always come from underneath this way. And then the next one will be, we're going to have him face up, and this time what we're going to do, this one can be a little bit more tricky, but I'm all about giving you options, okay? So this time we're going to come over, once again, towel. So yeah, coming around this way. So once again, arm needs to be up because we want to soften everything off, and then we obviously sink in from this direction. Okay, so we can come down here, close the arm over, sink in, push down, and then you're in there, okay? But we're going to do this, obviously, with a towel again. So, should have had a hand towel, but anyway, will suffice. Same scenario, coming into the posterior axillary area. So we're not into the axillary of the armpit itself. Sink in, so just the first point of resistance, which is about there, and then bring the arm down. Relax, relax, relax. That's all right. And then push the shoulder down, sink in again, and that's it there. So then we can just rock backwards, forward. So we don't need to be in here for too long. If you get onto these trigger points, you spend about 10, 20 seconds in here, back out, okay? And then we come down to the next slot. So that's how I approach subscapularis. You can check their internal, external rotation. What I like to do afterwards, once again, check what that abduction's like. So putting my hand over the top again, see what that humeral head's doing. Then I can start to work on, obviously, infraspinatus, pec minor, a little bit of the neck, what's the first rib doing, all that sort of stuff. But we're obviously just looking at this particular technique for subscapularis and teres.